Thank you, Mr. Speaker. Last year we passed the non-medical switching bill in the House 96-0, and you recall this bill prohibits health insurers from switching a covered person's prescription drug to a less costly alternative or increasing the cost of the drug on the covered person when the individual is stable on the drug and their health care provider continues to prescribe the same drug. We passed it again 96-0. It went to the Senate, and the Senate amended the bill simply by changing the dates, making the effective date January 1, 2025, instead of in the original bill, it was January 1, 2024.
Is there a discussion on the amendment? The chair recognizes the representative from Cass, Representative Mohr.
I didn't mean to speak on the amendment. That's all right. I'll just go ahead and say this. I worked on step therapy 8 years ago. 7 years ago, I started on this bill. It went to Gary last year, and he championed it through the House. And I'm just so happy to see this come to fruition finally after 7 years. It seems like 7 years seems to be a theme of mine. But anyway, I'm glad that this is moving across, and I hope everybody will, as we have, I believe 4 times in this House, passed it unanimously off the House floor.
The chair recognizes the representative from Polk, Representative Srinivas.
Thank you so much, Mr. Chair. Friends and colleagues of the House, this was one of the main reasons that I really wanted to be a legislator, to help fix this issue. And I was really excited to work on this as my very first bill when I became a legislator. And it is very great to see that we're going to do something so good for patient care. So I want to thank Representative Mohr for championing this for so long. And it was really wonderful to work with both Representative Best and Representative Mohr on this last year, and now seeing it come to fruition. Thank you.
Seeing no further discussion, the chair recognizes the representative from Scott for closing comments on Amendment H8335.
Again, I want to thank Representative Srinivas and Best who helped work on this bill. And Mr. Speaker, I move that the House concur in the Senate Amendment H335 and ask the body to vote aye.